Okay, so I'm going to show you a technique to help mobilize the nerve. What does that mean? That just means that we're going to do kind of a stretching drill to try to release any tension you may have on a nerve. Typically, it may be pain down the glute, or sometimes it'll even go down the back of the leg, the side of the leg, or often even down the calf and into the foot. So we're going to take that nerve and we're going to what's called flossing, neural flossing. So we're going to take the nerve and we're going to kind of move it from both ends. So depending on which side of the body the nerve pain is going down, let's say it's my left side. So I'm going to take my left leg across the midline, which means I'm going to cross over, but I'm going to rotate this leg, the leg that I just took in front, I'm going to rotate it in, and then I'm going to square my body. So even doing that, as soon as you take a leg internal and cross the midline, you're putting the nerve on stretch. So here's what you do. You're going to hinge forward at the hip until you feel tension in that nerve, and right about there. So once I get there, I'm going to bend the knee, and then I'm going to lock the knee. And that's going to be mobilizing that nerve back and forth. Then I do 5 or 6 reps, and then I'm going to go down even further, and then I find a new level of tension. I feel the nerve there, and I'm going to lock my knee, soften the knee. Lock the knee, soften the knee. I'm talking about this front leg. Do about 5 of those. I come down even more, same thing. Lock, soften, and go back and forth. And I'll typically do that about 3 or 4 different levels. I'll stand up. And then what we're looking for is a reduction in nerve sensation. That nerve pain that you get, you'll know you're heading in the right direction when it gets better. It either will come up the leg, or if it just feels like a big weight's been taken off. So what I usually do is I always like to test first, and just to see if there's less nerve pain. Now, I've had many disc injuries over the last 25 years, so I've got some residual nerve stuff always going down. Not bad, but I always have a little bit of neural tension. And every time I do this, I always feel better. Like that right there, I have way less nerve tension in that left side. So you can do both sides, but highly recommend you use this, practice it, play with it a bit. Don't overdo it, but see if this gives you any relief, because we all suffer from the nerve, that nerve pain. If you sit a lot or you have any disc injuries, you need to learn how to mobilize and floss those nerves so that the brain doesn't sense that there's that much tension around it. And sometimes that'll just alleviate the pain. So give that a go.